Greetings, listeners and learners. Welcome to our fourth episode of Healthcare Headlines, a podcast summarizing the recent major healthcare news and what you need to know. I'm Dan Grauman, Managing Director and CEO of Verilon, a management consulting firm that helps clients with their most challenging issues in strategy, finance, M&A, physician alignment, and compensation. We also offer our virtual board education solution, which is a tech-enabled, video-based governance education service for board trustees. This podcast will live on our virtual board education platform. So let's jump right in. First up, insurer Elevance Health, formerly Anthem, launches primary care delivery platform with private equity firm CD&R. So what's going on here? Mosaic Health will be a national care delivery platform, primarily for primary care, focused on risk-based care delivery models. Elevance's existing care delivery arm, Carelon, will become part of Mosaic, subject to regulatory approval. This is part of a trend we've been seeing for many years, where large national insurers are building out and acquiring provider networks. Other examples of insurers doing this include United Health Group's Optum and Cigna's Evernorth. Next, Walgreens is considering selling all of its shares in VillageMD after news that we reported in early July indicating that Walgreens was seeking to reduce its investment in VillageMD. They're now considering selling their entire stake in the chain of primary care clinics. In the last few months, VillageMD has continually scaled back its operations, closing over 160 of its more than 200 clinics across the nation. Next, there's an apparent slowdown in healthcare bankruptcies in 2024. According to a report from the healthcare advisory firm Gibbons Advisors, fewer healthcare companies are projected to file for Chapter 11 bankruptcy protection compared to 2023, driven by a decline in filings by middle market companies. However, among large healthcare companies, it's projected that a similar number will file for bankruptcy protection. According to Gibbons, this decrease in bankruptcy filings does not necessarily mean that healthcare organizations have moved beyond their financial woes, especially since restructuring efforts may be taking place to avoid the bankruptcy process. Next up, average hospital days cash on hand, a key metric, is at a 10-year low. Median days cash on hand dipped to a 10-year low for U.S. hospitals and health systems, according to an August 7th Standard & Poor's Global Ratings report, reflecting the financial headwinds facing hospitals during the last couple years. There's still a gap between the haves and have-nots. Top performers reported 2.5% operating margins, while the lower half had negative 2.7% operating margins on average. This report goes on to comment on several other related issues, including debt levels, credit quality, and so forth. And in our next story, Steward Healthcare's post-Chapter 11 saga continues to play out. Private equity-owned Rural Healthcare Group plans to acquire Steward's physician group, Stewardship Health. Rural Healthcare Group is a private equity-owned operator of primary care clinics in North Carolina and Tennessee. Previously, Optum expressed interest in acquiring Stewardship Health, but backed out of those plans because of a cited Justice Department review. Next, several state legislatures continue targeting private equity in California, Massachusetts, and Minnesota. Many of these bills increase the scrutiny by state regulatory bodies on private equity ownership of healthcare providers and facilities. Some prohibit private equity or hedge funds from controlling or even contracting with healthcare entities. Some of these bills may be knee-jerk reactions to scrutiny of private equity and their ownership of healthcare organizations, such as Steward Health that we just reported on, which was based in Massachusetts. Some bills targeting ownership of healthcare provider organizations by non-clinicians have failed in other states. If these bills pass, it could change the landscape of healthcare provider organization ownership in some states, causing large national insurers with provider networks to have to retreat from certain markets or prevent new market entry. And it could impact the ability of private equity to continue investing in healthcare provider organizations. More to come on these updates soon. Next up, federal drug cost negotiations are drastically reducing the prices of medications frequently used by Medicare beneficiaries. This will impact what is referred to as the maximum fair price for 10 selected drugs for Medicare Part D plans beginning in 2026. These maximum fair prices are anticipated to save Medicare $6 billion in 2026 and reduce out-of-pocket costs for Medicare beneficiaries by $1.5 billion. This drug negotiation was made possible by the Inflation Reduction Act of 2022 that requires the Secretary of Health and Human Services to negotiate drug prices for certain drugs covered under Medicare Part D and Part B. Next, let's discuss the closure of rural obstetrics units. Over the last few years, a baby bust has led to the closing of OB units in rural areas. Closing of OB units in rural areas can pose challenges for pregnant women who lack reliable transportation and have difficulty traveling long distances for care. And last, here's an update on the FTC's proposed ban on non-compete agreements. It was struck down by a federal judge. As you will recall from an earlier episode of this podcast, the FTC made a move earlier this year to ban non-competes. The FTC views the ban as fitting into its strategy to curb anti-competitive activity in the healthcare industry. In late August, however, a federal judge ruled that the FTC does not have the authority to ban non-compete agreements. For healthcare organizations, the ban would make it less burdensome for clinicians and staff to move between organizations. The American Hospital Association was not in favor of the ban, arguing that it would disrupt hospitals and health systems. We'll see what comes next for the FTC's proposed non-compete ban. The FTC reportedly told Beckers that they're considering appealing the federal court's ruling. It is highly unlikely that this issue is settled. So that covers the major healthcare headlines for the past month. The one constant we can count on in healthcare is change. So tune in next month for new developments in episode 5 of Healthcare Headlines.